Hello, good evening, and welcome to the Royal College of Nursing mini webinar series on employability for student nurses and new graduates to the profession. My name's Christine Mackenzie, and I'll be working with my colleagues this evening. Lucy Tomlin, Rihanna, and will be working to make sure that you have a good experience and that we do as well. We're excited about today. We're kicking off this series that has been requested by our student members, and we really hope that you enjoy tonight's webinar. In terms of housekeeping, we've got a chat and we've got an opportunity for you to ask questions and answers as the webinar progresses. We're going to take two opportunities to pause, one short pause where we'll take one or two questions, and then as we come to the end, we'll have a bit more time in terms of us having dialogue together. So please ask any questions that you want, anything that you don't understand, put that in the chat, and Lucy and Rihanna will be monitoring that for us as we progress through the webinar tonight. I'm really conscious of time, so without further ado, I would like to introduce our guest speakers this evening. We're fortunate to be working with Deborah Sturdy, who is the Chief Nurse for Health and Social Care. And Deborah will be talking about a career in social care, and it's really, really exciting. I have to say, in terms of preparations, when I spoke to our guest speakers tonight, I thought to myself, do you know what? I'd be considering a career in social care. There are some fantastic opportunities, so brace yourself. We're going to be hearing from Andrea Fitzpatrick. Andrea is a newly registered nurse working in dementia care. She actively chose her first job in social care. First job, first choice. And again, I think you'll be blown away by the comments and discussion that Andrea creates through her presentation. And then we'll just pause for a little bit there just to see if that you've got any questions or anything that you want to be clarified before we move on to our final speaker of the evening, Pat, who is going to be talking about complex care, and Pat is a senior lead within Prestige Care Home. So really fortunate to have our three speakers here. And I'd like just for us to move on because there's so much to be heard and to engage with. So welcome. Thank you for giving up your time this evening to be with us, and we hope that you value the time that we'll spend together. Thank you. Without further ado, I'm going to hand over to Deborah, who will take us through with our guest speakers.
Thank you, Christine, and evening, everybody. It's really good to be here, and I'm particularly pleased to be talking about social care nursing. My career has traversed both health and social care and an academic post, and now currently work at the Department of Health and Social Care as the first chief nurse for the specialty. So that's a great honour for me. So I am inevitably going to be impassioned about this really interesting option for you as a career, both now as you start thinking about what you're going to do next when you qualify, but also if you choose to do something in the NHS somewhere you might want to be in the future. So I'm going to put a bit of context around this for you. There are 19,000 employers in social care. It's not like the NHS. There isn't a big group, that big oversight of what goes on. These are all independent providers and independent employers. So that makes life a bit challenging in social care if you're a nurse in terms of connecting, but I'm going to go on and tell you about all the exciting things that we're doing. We've currently got 34,000 registered nurses employed in social care, a total workforce of 1.7 million. So it's mainly made up of that care workforce, and which means that the registered nursing workforce is even more important within the context of social care. And with that 1.7 million, we're actually a bigger employer than the NHS, and not many people realise that. So this is a huge opportunity in terms of people's careers. And I say that social care nursing is not for the faint-hearted. We need the best nurses. These are nurse-led services. There's not the machine that goes beep, and the doctor's not going to come running through the door when things go wrong. It's actually very much about the autonomy of practice of nursing within that kind of community of practice of of nurses working alongside you, and very much focus then in terms of that collaboration and work that we do with primary care colleagues, and obviously that interface with secondary care as well. And there's also an element of working with our community nurse colleagues and actually services such as hospices when we support people at the end of life. And social care nursing spans all sorts of areas of practice. So it's not just, I think, that kind of outdated view of you going into a care home and you're going to sit around drinking cups of tea and playing bingo on a Friday afternoon. It's much, much more than that. We support people in terms of learning disability nursing, people both living within communities and in kind of more supported care home environments. Some of those are peripatetic roles across services. We also, there is an element of mental health services within social care, as well as those more traditionally thought of support to people, both older people and also younger people with complex needs. So it's a very diverse community of practice to be in. And that makes it interesting. And I think the one thing that also people, some of the outdated and the mythology about social care nursing, it's a place where you go to end your career and not start. And I know that Andrea is going to dispel that myth for us. But actually, this is a really exciting growing specialism. So if I just talk about some of the things that we're doing in this space currently, because I was really determined when I came into post that we really develop the specialty, that we really get some definition around it. So we've got, for the first time, the first Professor of Social Care Nursing, Professor Claire Pryors, based up at Salford University, who's going to lead the charge in terms of developing both research and education in this space. There are lots of universities out there, and I hope some of the ones that you're currently have shown an interest in social care nursing and are working very hard to develop programs in terms of advanced practice. And we're just about to launch this summer a piece of work with Skills for Care, my colleagues at Skills for Care, around actually every student nurse have a placement in social care, so that we can change the perception and change our future workforce as well alongside that. Another thing that's really important is how we develop our research agenda within social care nursing. So as I say, we've got Professor Claire Pryor in post. There are lots of universities, as I say, alongside doing other work. And we've also got Dr. Zena Aldridge as the first nurse fellow in social care nursing at the National Institute for Health and Research. Zena's work over the last 2 years as a fellow is now kind of translated into her being put in a permanent post as a deputy director leading specifically on social care nursing, and she's going to be launching a really exciting piece of work at the end of this month that looks at a 5-year strategy for social care nursing. Alongside that, we're developing through a kind of Delphi methodology, a demand signalling, so we're getting nurses in social care actually defining what those social care research priorities should be. So we're really starting to build our momentum around that agenda. So we're looking at the student nurse experience and everybody having that, and then we're starting to build actually what do we need in terms of further developing our evidence base in social care. So those are two really, really major things, I think, that set us up for the future. Alongside that, advanced practice is going to become more important when we look at the 10-year plan that's happening at the moment with the current government. And where does social care nursing fit in there? Particularly around neighbourhood health, it's going to be a fundamental partner in the support that we give people. And I know that Patricia's going to go on and talk about complex care management, and you'll hear from her the kind of the complexity and the diversity of support that we give people in the community. And often it's where the NHS can't meet people's needs, particularly those on continuing healthcare support. So so developing advanced practice to me is an absolutely fundamental way of developing the career pathways for social care nursing. So we've got the Queen's Nursing Institute who've developed standards around that. There's further work going on in the NMC. They've just been doing a review of advanced practice. Social care nursing's been at the heart of that, so that we look at how we're going to develop these new careers and new roles. And there are a number of providers out there. I was talking to a director of nursing only last week, one of several of the bigger providers who's got a program for both developing advanced practice and also nurse prescribing. And the work that I've been doing here internally in the government around really pushing forward, and there's a huge amount of interest around nurse prescribing in social care settings. So again, how we're developing that step change to give the best possible care we can to the people we look after, because we are looking after the same people as the NHS. So how can we use our capability to the best effect? So investment in that is an absolutely essential for the future. So it's not coming into social care and seeing it as just a job where there's no opportunity to progress. And there's a whole variety of other careers around quality assurance, around management and leadership, particularly when you start looking at the bigger care groups and the regional roles that people have, but also in some of the smaller providers as well, looking at that, being that clinical nurse leader in that setting, being that person who's going to be that care coordinator. And again, this is not just about, I think the complexity of social care nursing is, it's not just like doing that kind of fundamental care planning, care management. It's much, much more. The interface and the exposure to primary care is immense. Looking at system working, looking at working with local authorities, the huge amount of work that goes on in terms of regulation with the CQC. There is the vastness of your knowledge in social care really has to be it is actually very broad and has to be absolutely sharp, because the scrutiny, I think, in terms of practice is quite intense. So actually it's a fantastic opportunity and place to learn. Some other work that we're doing with Skills for Care at the moment, I met their chief exec yesterday, is looking at developing further our work on preceptorship. So you're not, and Andrea I'm sure will refer to this, you're not just going to turn up and somebody throw the keys at you and say bye, see you tomorrow. There is an investment going into how we actually help people with those transitions. And my day started today talking to an acute trust chief nurse up in the northwest who is funding a post that's going to help develop social care nursing in his patch, but also looking at rotational posts through acute community and social care. So there's some kind of innovation and some real thinking about that. I also work with colleagues in the third sector, so the Foundation of Nursing Studies. I've got quite a substantial amount of money at the moment developing resilience-based clinical practice program for nurses in social care, open to everybody. So again, we're investing in how do we support nurses in these really important clinical roles. In terms of that wider leadership and that wider impact on the system, I work very closely with Duncan Burton, the chief nurse on the NHS side, but we've also developed social care nurse advisory councils in every region. So again, aligning with NHS colleagues, aligning with chief nurses in regions, aligning with ICS chief nurses as well. The voice of social care is absolutely essential. I think one of the things that we learned from that COVID experience is we are truly part of a system. We are part of a profession that has to work together for the best outcomes of the people that they serve. So that again, those kind of that relationship, the connectivity to the NHS is not lost. You're not kind of coming into a place of isolation and oblivion. It's very much, and I think as we move forward with the kind of agenda around reform for health and social care, we will see more and more of that close working relationships. There's huge amounts of resource available, and I'm going to put some of those in the chat when I've finished speaking, so that you can tap into those. And I think the other thing that I've been very conscious of, we've really built a kind of relationships and networks. So the Queen's Nursing Institute have got an infection prevention control network for social care nurses and a care home nurses network. Within Skills for Care, we've got a educators and a clinical practice network, and we've also got work going on at the moment in the background, and we hope, well not hope, we will be launching a global majority nursing network soon, recognising that we need to not only just support colleagues and for them to actually come together, but actually to shine the light on the very significant number of nurses that we've got from the global majority working in social care, and actually shine the light on on them developing in their career opportunities. So that's another piece of work that we'll be doing. And I'm also about to bring together the nurse leaders across learning disability again to think about how they can become a kind of a really important strong voice for learning disability nursing within the sector. And the RCN Foundation are just currently funding some research in that. We don't actually know where a lot of our LD nurses are working, so just do and LD and autism. So we're just going to do some work identifying those again. So how can we know where they are and how can we support people? So huge amounts of investment going into bringing colleagues across these 19,000 disparate services together in some common form. And I'm also working with the RCN exploring their fantastic regional independent nurse leads that they have, but also strategically with both Nicola Ranger as the CEO and Lynn Woolsey, who's the Director of Nursing. So talking to them about other strategic opportunities that the RCN can afford members, 40% of which work outside the NHS. So lots of work going on in that. So a lot of my time and my day is connecting to other people, getting this on the agenda, getting people realising that social care nursing is such an important place. And the other thing I'd say, so my career in terms of social care, my last job was the Director of Health and Wellbeing at the Royal Hospital at Chelsea. So working with veterans, we had a care home and site and a domiciliary service and people in a sort of supported living environment. And I can honestly say, and hand on my heart, it was quite hard work, massively challenging for all sorts of reasons in that position. But I can, at my leaving do, I actually said this, and I mean it. I've never laughed so much in any job I've ever had. The sense of community that you build, the relationships that you build with the people, I think not only who you're looking after, but their families, their friends and your colleagues is something quite unique. And I think those long-term relationships that you have with people, really do stand the test of time, and that you are together in that community. And there's something incredibly powerful and massively rewarding about supporting people to live their very best lives, whatever their circumstances, whatever their limitations are, and always seeking the best and the absolute art of the possible so that everybody gets to do absolutely what they want to do, however limited their life course might be, or however limited their ability is to do that. So that kind of diversity challenge, I think, kind of clinical challenge, opportunity to become a really effective nurse leader. And like I say, I think this is truly the place. And bearing in mind, I've been a registered nurse for 40 years. This is the place, I think, where nursing really comes into its own. And it truly is a nurse-led service. So, of course, I'm going to say that as the chief nurse, but I do think that it is a land of opportunity. And it's one that I would encourage you to consider and think about. Thank you.
Rukiera, lovely. Thanks very much, Deborah. That was really inspiring and such a wealth of knowledge in terms of updates. Going to move on to invite Andrea Fitzpatrick to join us now. Andrea is our newly registered nurse whose first job was in social care. Welcome, Andrea. Thank you.
Thanks, Christine. Thanks, everybody. Yes, so I recently qualified in September 24 and decided to take the leap into social care. I'm really lucky because I do have a background in social care, and I've spent quite a vast majority of my career in social care, especially in dementia care. It's where my heart lies. So I knew going into my training that I wanted to go back into social care. However, I knew that there would be many expectations of me, and it definitely wasn't going to be at all sitting about having cups of tea and holding hands. So going into my nurse training, I was extremely grateful for all of my placements, and I was able to take so much that I had learned from there and bring that into nursing in social care, especially in dementia, because although I had a huge background in dementia care, I didn't really have much knowledge about comorbidities and all these other health conditions that quite a lot of elderly people live with. So along with managing people's dementia, their journey day to day, I'm very aware of their other comorbidities and how that can impact and change their journey through dementia. So taking my first role, I've been really lucky to have a preceptorship. It was a 12-week preceptorship in the company that I work for now. It was also outsourced to Warrington Council, and I am currently in their preceptorship as well. So that's a little bit more kind of down the clinical skills route that we would have done through nurse training. So it's just a little bit of a refresher, and then I come back onto my unit, and then I'm assessed to, take bloods, insert both female and male catheters, and then we do have regular training. So I've recently done syringe driver training and verification of death. So working in a nursing unit that is of dementia, these are very important, because as these folks get towards the end of their life, a syringe driver may very well be an important part of their journey. And then being able to correctly verify somebody's death is a huge responsibility in itself. So there's a huge amount of training within social care, and it's very much not that you're just left on your own. I specifically chose a big home to start my career so that I could take advantage of my other colleagues in different units and houses. So I never felt like a newly qualified nurse. I never felt like I was on my own. Our home managers, one of them has been a matron in the NHS for so many years. So not only do I have my colleagues, but also management are hugely knowledgeable, and they very much encourage sharing of knowledge and bringing all of us up to skill. So I feel very grateful to be in a position that I can reach out to other nurses that have more experience, that are so kind, and they help me learn my journey. So yes, being newly qualified can be quite a worry, especially going into social care. You might think you're left on your own. It's just you and a senior carer, and you have to make all the decisions. And while sometimes, yes, that's true, you can be the only person to make these clinical decisions. There is a lot of support, and I would encourage anybody looking to get into social care, particularly into a nursing home or a care home. A bigger company will always have another registered nurse on duty alongside you, and more often than not, management are registered nurses as well. Whereas a small family-led business, you may feel like after 5 o'clock you're on your own once management goes. So just going back on a few things that Deborah has touched on, it is a hugely supportive environment. I would encourage anybody to come this way, and just see the amount of knowledge that you can learn. There's also huge knowledge outside of the nursing role and delving more into interprofessional care and interprofessional relationships that you build alongside social workers. So we would have, I now have a great wealth of knowledge around deprivation of liberty safeguards, understanding safeguarding of adults and both children, for the fact that, not that I take care of children, but children do come into the home, and being very aware of all residents, visitors, family members, other staff members, anybody that comes into my unit, I take responsibility for their well-being and safety, and that would include somebody's grandchildren or great-grandchildren coming in as well. So there's as much knowledge out there as you want, you can find it, and there's plenty of areas that you can splurge into. It's not just a dead-end role that you'll be there until the day you retire. There is plenty of opportunity for both growth into leadership and management, and also into clinical skills, providing training for junior members of staff, and being more clinically involved in things that happen regularly in nursing homes. And we take care of people that have a lot of comorbidities, and they do have complex care needs, and we take care of stoma bags and peg feeds, and end of life, it really is prominent in nursing homes, but it's also, I think, one of the most important areas of nursing that you can get into, because you're so lucky to be able to provide this person with a good, dignified death in their home, surrounded by their family, surrounded by loved ones. You love them, and you get to share such a wonderful experience in helping both the person on their journey of death, and also helping their family. There's huge relationships that are built in social care and nursing homes, like Deborah has said. And you get to know everybody's husband and wife, you get to know all of their children, all of their grandchildren, you get to know the dog's name, everything, everything about everybody. And everybody is so thankful for the care that you give, and anything that's changed in this person, because yes, you may have 20 or 30 people to look after every day, but you have to remember that these people are not acutely unwell. So they're just living their day in their home, and you're just making sure that if anything has changed, that, you can spot it, because these people so well. When somebody's not well, when somebody has a urine infection, when somebody's getting a chest infection, somebody's cough is different. And these are all the things that you never think you're going to know, and then it happens, and and you're just, I'm so shocked really sometimes about how much I know about people, the way they hold themselves, the way they walk, and how they change so dramatically in their dementia journey. So, we do support their family members a lot, because something as simple as a chest infection could take you from being independently mobile. You have this chest infection, the antibiotics have cleared the infection, but now your mobility has changed, and now you need a lot more care. You spot that, so you're helping the person, you're also helping their family, to move into this new transition in their journey. And there's a lot around leadership and management, like I had said, and I felt like through my nursing studies, knowing that I was going into social care, I knew that this would be a very important part of what I would do, because I am the most senior person on the unit. I have to make sure that the care team work well together. I have to motivate everybody, you know, to do the best they can. I really value and appreciate their work. If they don't turn up for work, it makes my day harder. I've got to sort a new problem. So I'm very appreciative of the wider team that we've got, and every role that everybody plays in keeping people at home and healthy and well. I also find there's a great work-life balance, which is something I really valued. I have small children, so working days and nights in the same week for me wouldn't have been ideal. It's not anything that I ever wanted. I now work on a 2-week set rota, so I know where I am every 2 weeks. I can plan, my whole year is planned, all my annual leave is put in, all my holidays are booked. I know what weekends I'm working, when I can take my kids to their sports, when I can turn up for family events. So I just work days. So I have a great work-life balance. I don't feel like I miss out on anything with my children. And I do feel that that's a huge benefit in going into somewhere like a nursing home, that there is that option available, where on most NHS wards that would never really be an option to do anything like that. Yes, there's huge autonomy. I make, you know, the important decisions. I make the decision when we escalate out or when we can manage in-house. I know an awful lot more about sepsis, the very early signs of sepsis, where you know, this can go downhill really quick. We need to be on top of this. And like I said, you don't have 20 or 30 people that are unwell. You may very well only have this one person that's unwell, so you can dedicate a lot of your day to this person to help them. Yes, and also bringing in outreach teams. So in the Warrington area, we have a NHS support system called Care Home Support Team. So they are like a medium between ourselves and the GP. So we can escalate our concerns to them. These are our band 6, band 7 NHS nurses. They triage the illness and they decide how we can manage something, if they need to bring us something. So they could bring us like syringe drivers should we need it. They order medication for us. They're able to prescribe medication that we need that can get straight to the pharmacy and we can collect it within an hour for starting antibiotics or whatever it might be. And we're not waiting on the GP, to call us back or anything. So it's a really good system. They come and review all our residents weekly. If there's anybody that didn't have a problem yesterday that now looks like they have a problem, it's a fantastic outreach team. We also have the virtual team. So anybody that will be discharged from a hospital that is medically fit for discharge, but maybe, a couple of things aren't 100%. They come in on a daily basis and then they go back to an MDT. They give us further advice on how to manage whatever the person might be going through, and then they discharge generally after a few days or a week. So we are very autonomous in social care, but we also have a huge amount of outside support. Definitely don't feel like I'm on my own in any way, shape or form. I have a wealth of nurses around me that are more than happy to share their knowledge and help me develop, which is really fantastic. So I genuinely could not recommend it more. And if you like dementia care, this is the place to be, honestly, because you can do it right and you can do it so well and so right, all in this person's home and their environment. So I'm really, really thankful for the way that my journey has panned out for me. Yeah. Thank you.
Wow. Thank you so much. I mean, how complimentary to Deborah's beginning, but you've offered so much. I mean, I could say some of it, and I really don't want to, because I want to just see if there's anybody, any of our attendees that want to ask any questions. But and I think at the end it would be just lovely to bring it all together. But you've offered so much wisdom, and your passion just shone through. I mean, yeah, totally amazing. And what I did love was that bit where you said, and you just know them, and I was imagining that I could remember that from my own clinical practice, but in the way that you described it, you sort of said, the way they walk, the grandchildren, the name of the dog. I was like, wow. Yeah, thank you so much, Andrea. I'd love to just see if there's anything in the chat, if anybody wants to ask any questions, just before we move on, so that our attendees might have a chance to have their voices heard as well. So let's see if there's anything there. If not, we'll invite Pat, and then I think we'll get to a place where we can have some open dialogue together. Thank you, Andrea.
Yeah, no worries. Thanks.
That was lovely. Yeah.
Thank you.
So we've got nothing in the chat. I mean, I'll just give half a minute in case does anyone want to ask anything in the chat? I'll give half a minute, and then I think we'll move to Pat, because I think, as you can already see and hear, the dialogue, the exchange is just so rich. So if there aren't any questions, then I think what we'll do is we will invite Pat, who is our final guest speaker tonight. And I did correct myself in the chat. I got Pat's title wrong in the beginning, so apologies for that, Pat, but a warm welcome, and I'll hand over to you to take us to near the finish.
Thank you very much. Good evening, everyone, and thank you for having me here today to talk about social care. So to follow up from both Deborah and Andrea, what they were saying, it really is a vocation, social care, and there is so much innovation at the moment. There's so much passion at the moment. There's a lot of momentum for this sector, and we're doing a lot of really good things. You can really feel the positive changes and influences that are happening at the moment. So if I tell you about my sector, so I work for a company. We support with domiciliary care and complex care at home. So a lot of people, when it comes to complex care, aren't even aware kind of these things exist, and we found out with a bang in COVID that they'd forgotten about us, and they didn't know we were there, but we were there. So the types of clients we have may have some clinical needs that they need, support at home, and we support people with PEG tubes, stomas, who have tracheostomy tubes, need ventilation, who have some type of spinal injury, who need bowel management, catheterization. We support all clients like that within complex care. And one of the things that we do that is quite unique as well and special is a lot of the clinical care that our clients need is actually delivered by carers. So the nurses lead the packages of care, and they are our facilitators, they are our advocates, they are our people that reach out to the multidisciplinary team, ensure that the care we're providing is person-centred, is individualised, and they put that plan into motion, using all the specialists in the community to make sure that it is safe for that client. And then they upskill and train and delegate a lot of these healthcare tasks to carers, who then will support the client. Some of our clients have 2 carers with them 24 hours a day and need that level of support. The nurse isn't always there, but the nurse is the one who is managing the overall care delivery within the package. So they may have more than one client. They may have a caseload of 8, 9, or even 10 clients, depending on their complexity. And it is really a juggling act. So we're working with our clients, and everyone's got their preferences, their needs, their wants as well. And sometimes the choices that we make aren't necessarily what a choice that someone else would make. So we need to balance all of that to make sure that we are being personalised with the care we are delivering, so that we can make sure our clients are happy but also safe, and we've got trained people to deliver that care that they need. So it's a very, very busy sector. There is a lot of leadership involved in that. Our nurses are autonomous. They're there to kind of look for any risks. They're constantly risk assessing everything that happens. They work within quality as well as leadership. So they do their audits of the documentation, of the care that's being delivered, of the quality of care. They're part of the training. They train our carers with the skills, and then we'll go out and assess them as competent. They manage as well, so they will support some of the care staff, do their supervisions, do their appraisals, make sure that they're developing at the rate that they need to, and putting in support mechanisms if they need extra. So there is so much to do. It is not for the faint-hearted, like Deborah said earlier on. It does take a really resilient person to kind of get all of the things working in order for it to work. There's a lot of reaching out to other specialists, multidisciplinary teams, GPs, primary care, for them to either support or contribute to the care plans that we're developing to make sure that it's all safe and effective as well. One example I like to give is that within our company, and we regularly are able to support some of our more complex clients go on holiday. One of our clients with quite severe spinal injury, who has a tracheostomy tube, fully vented 24 hours a day, we were able to take them on a 2-week cruise around the Caribbean with just carers, no nurses. So we can do really amazing things when we put our mind to it. It's not an easy task to get all of that sorted out, but we were able to do it. And it's just constantly reviewing the care that that client needs, reviewing escalation plans, reviewing care plans. You know, if something different happens, let's say they got a chest infection, we're reviewing their breathing and respiratory care plan again. We're risk assessing, we're getting more advice from their specialist team. What do they need? Going back to the GP, what can support them? And we're at the most important place. We are those people's advocates to allow them to have a life. They're not sick people. They're not unwell. They don't need to be in bed all day. They don't want that all day. They want to live a life just like everyone else. They want to go to college. They want to go down to Primark. They want to go to Costa. They want to do everything that we want to do. So, you know, our nurses within social care have really got to be advocates for our clients, to be able to provide this type of support for them as well, to make it normal. It's not a big, exciting, interesting thing. It's just a normal thing that we're doing for someone to make sure they're able to have the best quality of life that they want and they deserve as well. I think that's all from me. Unless anyone's got any questions, I'm happy to answer later. But thank you for listening.
Lovely. Thank you so much, Pat. Again, just another the richness that's contained within this webinar tonight is just true. I think when we watch it back and others watch it back, I think we'll realise and make more sense. But I loved the way that you normalised it, you know, going to Costa, the clients want to go out. And actually, if you need anyone else to do that Caribbean cruise next time, you know, if you're short, train me up.
No, we're not sure. I've got dibs on the next one, but thank you for your offer.
Thank you so much. I'm wondering if we've got any questions in the chat or comments, and also anything in the Q&A. So we're going to open up now just for under 10 minutes, just in terms of those that have joined us this evening. Have we been able to answer your questions? Have you got any questions left that you'd like to ask? But I'm curious about what you're thinking. You know, now's the time. Really happy to, if you want to raise your hand on come on camera, you can. If you don't want to do that, but you just think, oh, I would love to ask that, then pop it in the chat. Lucy and Rihanna are helping with that, so you know we can see it straight away and we can answer the question on your behalf. I'm going to give you a couple of minutes. I hope it might be useful just to do a short refresher of what we've heard. I mean, I guess we begun this evening with Deborah offering us an overview of the strategic direction for social care, the partnerships that are being formed with the Royal College of Nursing, but also with the Queen's Institute in terms of innovation and advancing practice in social care. So many changes, I think, from when I was in clinical practice. We then heard from Andrea, who talked about choosing her career, and Lucy might help me out, but I think I've got some headlines. Lucy, if I've missed anything and you want to add anything, please do. I mean, really, the thing that stayed with me, I'm going to talk about work-life balance, because Pat mentioned about, you need to be resilient. And I thought to myself, resilience can come from well-being. Well-being is about getting rest. So actually, Andrea's chosen that for her and her family. Really great to hear how she's balancing that work-life balance. So, she knows when she's working, she's got this 2-week rota, she can book her holidays, and she's there for her family. So, I thought there were multiple pluses when we're thinking about managing the work-life balance, but also the availability of training. So I think that there are multiple advantages for a career in social care that perhaps when I was nursing and in nursing practice weren't available, but not as obvious. And there's more to come, so stay tuned. Have we got any questions, Lucy? What's happening? Help me out.
Hiya. Hello everyone. We haven't got any direct questions in the Q&A chat yet. I have sort of suggested that if people don't really want to appear on camera or don't, they can remain anonymous and post things, and we'll ask on their behalf, but nothing's been generated just yet. But I was just wondering whether I might pose a question. Is that okay? To anybody really, but probably mainly Andrea might be a good person to ask about what sort of specific skills or behaviours that would be being looked for somebody who was thinking to come in to social care as a nurse. So what sort of skills or behaviours would they need to develop, which might help them at interview or to achieve a role within your sector?
Great question, Lucy. Yes, I definitely think a strong nurse is needed. Somebody that is comfortable with leadership and management, somebody that is able to delegate, communicate effectively. I think they're kind of the more managerial skills that would set you up really well. And also, taking from what you learn in university, always back to your observations, your A2E assessment, SBAR, like all these things we use without even thinking that we're using them. So yes, I do think there's a great mix between clinical knowledge, but also a lot of communication skills. Effective communication skills would be really, really important. And having that strong voice to be able to articulate and challenge where you feel necessary for your residents, really.
Lovely, lovely. When you say that, it makes me think about what are some of the things that we're learning, that the students might be learning now? Because I guess when I'm listening to you, I'm thinking, oh yeah, no. And then I remember that you had that experience of being a healthcare assistant as well. So I'm sort of thinking, what are the sorts of things that we might be able to think about together where we can, so that for people listening, they might get a sense of, oh yeah, I'm doing that. Because when you say a good communicator, I'm thinking about communication that might happen outside the boundary of nursing practice that we can bring to the experience of working in social care. So what might we think about or share there?
So I would, with dementia being my heart, I feel that I need to be very adaptable in my communication skills. I work with a gentleman who just thrives on a firm woman's voice in getting him to do what we need him to do. So he absolutely responds really well to that. But then, you know, there's another lady who's so softly spoken and doesn't like loud noise. You know, really loves holding hands. You know, so being adaptable. You need to be very adaptable, especially in dementia care. Whatever the person needs, you have to be able to provide that. And then I think communicating effectively, you need to be able to have a voice of authority to make sure that all the carers are all in line, that you're being respectful, speaking to heads of management, but you're also always thinking about your resident. You're always thinking about how we can make it better. And you do need to have a strong voice, and you do need to be quite a good advocate, because it's very easy, you know, just to kind of let things slide, and it definitely doesn't work that way.
Lovely. Thank you so much. I'm just going to pause you because I think we've got two hands up. Pat, I saw you first, but do you mind if I go to one of our attendees and then I'll bring you in? I'm almost sure someone else has got their hand up, but I can't see it. Yeah.
Hello.
Hello. Welcome.
Yeah, hello. Yeah, my name is Anelia. So currently I'm doing my management placement, stroke unit in Princess Royal University Hospital. The conversation is very interesting. It's very useful. What I would like to ask, if it's possible, Patricia, because my plans, hopefully, when I reach that point to get my PIN, I don't want to restrict myself only in the hospital environment. Is it possible, new qualified nurse, to do this 24-hour constant home care with people with more clinical procedure like tracheostomy or spinal injury? And is it always to be full contract nurse, or bank shift also it's possible?
Okay, lovely. Nice question. So let's bring Pat back on and she'll be able to respond directly to you. Thank you for answering that question.
Yeah, thank you for the question. I can only respond in a kind of overall, very broad sense. So as a newly qualified to pick up banking agency, most people would like you to have a bit of experience, but those settings are places that you can go to. What I would say is a bit like what Andrea did: find a place that has got a preceptorship and can support your learning and development within that. Within complex care, there's almost two levels. There's clients that need the care delivered by a registered nurse, and there's clients who can have the care delivered by trained carers. So there are packages where you could work with the client directly to learn all of those skills around tracheostomy management, catheter care, while the nurse is leading the package to be able to support your development as well. So I would just maybe reach out to a few agencies. There are some big complex care kind of care homes out there as well. Maybe reach out to them. A lot of them will take newly qualified people and support you in your development as well. But it's definitely an option.
It's definitely. And is it possible to tell me again the name of the institution?
Which institute? Where I work?
Yeah, exactly. Yeah. I mean, where you work at so currently, yeah.
So Prestige Nursing and Care, that's where I work. But again, I would have a look around and do a bit of research for similar agencies, similar facilities as well that could support you as well.
All right, I see. Thank you very much. Thank you.
No problem.
That's lovely. Thank you. We've got about 3 minutes to go, and I suspect that we're just warming up and we might come through with a few more questions, but I'm mindful that it's early evening and the evenings are lighter and that people will want to move on and do other things this evening. So what I'd really like to do is I'd like to thank our guest speakers, Deborah Sturdy, Chief Nurse, Andrea Fitzpatrick, newly qualified nurse, first job, first choice, that's so shone through, and Pat Conti, who is the head of clinical services for Prestige. Thank you, thank you, thank you. And more importantly, I'd like to thank our attendees who have given up their time to be with us this evening. And I really hope that you found it as informative as we have. Good luck in your choice, and you'll be able to view this recording in the future. It will be online for you for 6 months. Also, we're going to post at the end of this some additional resources that you'll be able to scan in terms of the QR code. And a big thank you to the team behind the scenes, Rihanna, Lucy and Will. Without your support, it wouldn't have been possible. Thank you, thank you, thank you. I think we've got 2 minutes left, so we can show the last slide so that people can scan the QR code. And it would just be nice to give that a minute, and then maybe in the last minute all speakers could come back on and people could see them as we say goodbye.
And just say thank you to Christine for your warm welcome and for letting us talk about social care, which clearly we're all very passionate about. So
yeah,
thank you too.
Lovely. Thank you, Deborah. Thank you. Oh, and don't forget, I've meant to promote that. Thanks, Rianne. Don't forget that we've got 2 more webinars in the series. We've got one on the 28th of April, Stand Out and Get Shortlisted for Your Dream Job. And then on May the 8th, we've got Ace Your Interview, Expert Tips for Success. So thank you, thank you, thank you.
Yeah, thanks everyone for engaging. And I just wanted to add, I was going to add those qualities of a social care nurse. So be curious, be aspirational, be brave. Don't try not to be like me with a big mouth, but yeah, that's the kind of people that we need, those who can inspire on behalf of our clients.
Lovely, really lovely. Beautiful language. Any final words, Deborah, before we're on the boundary?
Just thank you to everybody for listening, and as I said in the chat, come and join us. We would welcome you.
Yeah, lovely. Thank you. Bye for now.
Good luck, everyone. Thank you. Bye.
Thanks very much. Thanks. Yeah, really inspiring. Thanks, Pat and Andrea. Really enjoyed that.